I can't say that I know exactly the moment that I wanted to become a physician. Um, I like to accuse my father of brainwashing me, but I think at some point in time I did a reevaluation when I was in college, and I thought, maybe I want to do teaching, maybe I want to do something else with my life, and I just kept going around in circles, and I came back around to the same point every single time. And so I think at some point in time I just had to accept the fact that I couldn't imagine myself doing anything else for the rest of my life. So what I like about women's medicine is educating women and allowing them to feel empowered to ask questions, to learn about themselves. For example, when I'm with a young patient, I like to talk to them about their bodies, their changes that are happening, puberty, and, encourage them to know that they can say no, that they can ask about sexually transmitted diseases and contraception, things that are very uncomfortable and awkward for anyone at any age, but especially when they're at that age and everything is very confusing for them. I like to be able to help provide some clarity. And in older populations, there are sort of a shift in the type of problems that they end up dealing with. So again, sometimes they are able to describe a problem that they're experiencing, but they can't quite put their finger on why it's there. So again, being able to educate women as their bodies change. Menopause, for example, is a time where there is a shift in what they're used to and where they're going, and it's not the same for everyone. One of the most memorable experiences that I had with a patient is probably one of my most difficult. The patient had a complicated pregnancy. We did a lot of preparation for her delivery, and the delivery itself went quite well. But very shortly after delivery, she started to bleed very heavily. She required blood transfusions. She required a lot of supportive therapy, and we had to rush her back to the operating room. Luckily, there were other team members, and we all worked together on this in a very coordinated fashion. Anesthesia, the nurses, everyone on our teams, we all worked together, got her back very quickly. This patient in particular actually needed a hysterectomy to save her life. And during that time, I remember having tunnel vision and really just honing in on what's the next step and doing that. Very shortly after the case was over and the patient was safe, I remember feeling very anxious all of a sudden. So it's as if all of those anxious feelings that might normally come during that time waited until the case was over. To describe myself in 3 words, I would say calm, based on feedback from others. Funny, I think. I have a sense of humor. And diligent. In my spare time, I do like to cook a lot. I also, I'm very excited. I just got a piano. I played piano a lot when I was a kid, and I'm really excited to be able to get back to that. It's the first time I've had a piano in a long time. And both my fiance and I enjoy the outdoors. We like to, run and swim and that sort of thing. We have a dog, Yoda, who is very cute. She's blind, but she doesn't get angry when she walks into things. She just continues on, and we get to laugh about it and then hug her after that. But that's largely how we spend our time. I think what makes Orange Coast Women's Medical Group different from other groups is the camaraderie that they have. I am always pleasantly surprised at how genuinely happy people seem at the job. They joke around in the hallways, they tease each other in between, duties. So it makes for a very positive work environment, and it makes me feel like this is certainly a place where I could be happy for a very, very long time. And I have, over the last few days, been able to work very closely with a number of my other colleagues, and I really am impressed with their knowledge base, and I would be very comfortable letting any family member or friend of mine come to see them as a patient as well.